I'm fatigued, I'm having anxiety, I'm having depression. We do all of the things that we're trained to do. According to the lab, your hormones are normal until you get the additional training and understand, that a lot of the things that are going on is because of hormone imbalance. Hi, I'm Sharon. I'm a nurse practitioner, board certified. I work here at the MedSpa, and I also work primary care. And this is Jen.
Hi, I'm Jen Weiss. I'm a practice development specialist with Evexias Health Solutions, and we have partnered with the MedSpa By Beauty Bar to help them offer hormone replacement therapy for their clients.
When we talk about, the reason why I personally was interested in, hormone replacement therapy, it's just, coming into primary care. That's what I do as a full-time job. And, I have patients that would come in with all these different complaints, when it extreme fatigue, weight gain, hair loss. We talk about anxiety, depression, all of those things, and just being trained in traditional medicine, you do all the things that you're supposed to do. You draw their labs, make sure it's not their thyroid, make sure it's not their iron, all of those things, and then I have so many people ask me, well, I think it's my hormones. And so, I'm open and I would check people's hormones and, realize that a lot of these things, it could potentially be because of hormone imbalance.
So those symptoms are like top of the list for most people. That's literally what people are complaining about all the time, is exactly what Sharon was talking about. And unfortunately, a lot of times when folks are going to their primary care physicians, they are not getting the answers that they need or looking for, and are oftentimes, kind of ushered out the door with, a couple of prescriptions or whatnot. And it's not that that's necessarily bad, but it's not going to treat the root cause of what they're experiencing. So it does then kind of fall on our shoulders as individuals to seek out care through other folks for specifically for hormones. It doesn't mean you have to change your PCP. You just want to find somebody who can speak to and has been trained in hormones.
And to just touch base on what Jen was saying too, me personally, I definitely feel like it was life changing. You hear that a lot from patients that are actually experiencing the hormone replacement therapy. Fatigue, it makes a huge difference. For me personally, it improved my fatigue by 80%. Brain fog, which, when you're working hours, you have kids, you have family, that's the biggest thing is the fatigue, the brain fog, being able to not only go home and, do all the other tasks and things that you need to do, but just the mood changes that happen as you get older. A lot of people say about the moodiness and the depression and anxiety and all the things that it can really help.
Yeah.
In general, and just to make people overall feel better. And I can honestly say that that's the feedback that I'm getting from patients, especially when we talk about postmenopausal women that do need a little bit of estrogen. We know that estrogen is a natural vasodilator, so it helps with circulation. So the biggest thing with estrogen for women is they talk about their joint pain is completely gone. We've had people able to wean down on antidepressants because their mood is better. And all those things that just make you feel overall better as a person.
Yeah. And that is so important, that I think everybody needs to hear, is that this stuff does change. I mean, people say it's life changing for a reason, right? I mean, when you're talking about the depression and the brain fog and all that stuff, a lot of that oftentimes is also attributed to just lower testosterone levels. And lower testosterone really starts to hit us women when we are in our 30s. And if we have children, that speeds it up even more so. So your testosterone is kind of like declining even quicker. And so when women are 36, 37, 38, they're like, well, I'm too young to have hormone replacement therapy, but I don't feel well whatsoever. And so then it's like, well, it's probably because your testosterone is, just tanking at that point. So when you see somebody like Sharon, or you see your local HRT specialist, they're going to be able to help at least with just the testosterone if you're that young, and it's going to help you alleviate a lot of those symptoms that she was just talking about.
And when it comes to that too, it's just a matter of just having labs drawn, And so, some providers in primary care or GYN or whatever, if they're not willing to draw labs, it should take someone just so that you personally know as an individual, the worst thing you can do is say, hey, my hormones are fine, everything is good, and kind of move on from that. But there's so many people that are struggling with knowing that there's something wrong, and everything else in terms of physical exam, in terms of labs, in terms of, you know, reviewing medications, that everything is fine, but the patient still does not feel well. And so that's kind of the things that, you have to think as a provider, you still have to try to explore that. And that's, my goal.
Mhm.
Just because me personally, I know that it works. And then just the feedback with, everybody that we've treated in the last couple of months has really said that it's made such a huge difference in their lives.
hmm Well, and with the labs, I mean, that's a huge part of it because sometimes you'll go to a primary physician and they're like, oh, we don't really do labs. We're just going to give you a cream or we're going to give you an oral dissolved tablet. We're just going to kind of see how your symptoms go away. Right. Um, but it really is a little bit more so than that. If you can get a custom dose, that's the best thing because that's what your body needs. And we're looking to optimize those hormones, right? So a lot of times you'll go and you'll get your blood work done at, a family care provider or whatnot. And they're going to say, okay, you're a 47-year-old woman and this is the normal range where you should be as a 47-year-old woman. Well, I'm almost 47. I think I don't want to be compared to 47-year-old women who are, out in society right now, because by and large, a lot of them are not as healthy. So I don't want to be in that same sphere. Instead, I want to be optimized. Where was I in my late 20s, early 30s? Because that's kind of the goal. And when you have labs and you see how deficient or how imbalanced things are, then you're able to get a custom dose from someone like Sharon. And she's going to say, gee, this is exactly what you need. And she's not going to overdose or underdose. It's kind of like this sweet spot for the patient. And then they feel better about having exactly what their body needs versus just something that's based off of some symptomatology and normal lab results. Okay, so Sharon, sometimes when I'm out talking to people just randomly and we're talking about hormone replacement therapy, and if I talk about a med spa, a lot of times these folks are like, oh, I don't know that I want to go to a med spa. I'm going to go see my family care doc or I'm going to go see my gynecologist, which I think to me is silly.
Mhm.
I shouldn't say it's silly. It's okay to want to keep those relationships, but to not go to somebody who's at a med spa because they're at a med spa, that's the part I think is silly. So, what would you tell them as far as like, why wouldn't they come here?
Yeah. And I think there's just misconception, that people at med spas, they don't have any traditional medical training, which, obviously is false because you don't get a degree in how to work at a med spa. And so, we get the same type of training. I'm sure most people are familiar. You go to your primary care office now, you go to specialist office now, and you can see a PA, you can see a nurse practitioner, and we diagnose and we treat and we do everything, that we're supposed to do in terms of, safety and efficacy and treatment of overall patient care. And so, for me, it's just the fact that, I'm still versed in that. I still do work primary care, but then I, you know, took the time to understand something that I felt like is something that people are suffering with, right?
Yeah.
Hormone imbalance.
hmm
And you just get extra education and extra training on that. So to me, I feel like, I took my education one step further to
hmm
understand the hormone optimization, how hormones affect us.
Yeah.
And it's kind of like a non-traditional approach to medicine.
I completely agree. So when we talk, so I go around and I talk to lots of physicians and nurse practitioners as well. And every time we start talking about hormones, when they're being honest with me, they tell me, we covered about one chapter in hormones.
Mhm.
We covered one chapter maybe on menopause, where they spent like years and years in school, but they spent like almost no time studying female hormones. Male hormones is another thing. But it's like, I commend you on what you did, that you said, no, people are suffering from this, and I'm going to go get educated and get certified with really great training so that you can continue to help your clients. So I think that if anybody is looking to get hormone replacement therapy, that there's nothing wrong with going to a med spa. It's just you want to do your due diligence regardless of who you're going to see. If it's a gynecologist or a family care doc, you want to look at them and where they go to school and judge it on that, not based off of the sign that's outside of the building. So, Sharon, I know that I have my thoughts on this, but you can tell me what are some, like, who would be a candidate for hormone replacement therapy? Because I think a lot of people are under the misconception it's like only women who are, menopausal, or men when their thing doesn't work anymore. Like, those are the two things that most people think of. So what are some other examples where people might think, oh, maybe my hormones are out of balance because of.
I mean, just kind of when we talk about all the symptoms that people kind of experience, right? Um, Obviously, for women, I mean, testosterone, gives so much more energy. And that's, if you ask a middle aged woman that has kids and that is working, or not working, working from home, whatever they're doing, taking care of their kids and taking care of their family, the biggest complaint for women um, is the fatigue level, not having enough energy. And then when you get into relationship stuff, we hear so often with couples that are like, we're not intimate because I don't have the desire, or, we're not intimate because my husband has the inability to, perform. And so those are also the things that we see a lot. And that's also what brings people in, because
Mhm.
it's just about talking to people and feeling comfortable about talking to
Right.
people about it, and being open, um, to make people feel like, that it's something that's appropriate and something
Yeah.
that can really help and change how they feel
Right.
overall. Yeah. So I kind of touched on, my personal experience and how it's totally changed my life with the fatigue. Jen, what do you think about your
Hmm.
hormone
Hmm.
therapy? And,
Yeah.
because you do come here for your pellet.
I do, and my husband both do. So we go to a med spa. We see Sharon. So my story was that I was one of those people where I thought, well, I was too young for pellet therapy or any kind of hormone replacement therapy. But what I had started to learn was, okay, I started like connecting some dots. So essentially, I was waking up in the middle of the night with headaches for no apparent reason, and I would wake up with it and it wouldn't go away for like 2 hours. So that was kind of miserable. The other thing is that I have always, for since my 20s, I love going to the gym. I love lifting weights. I want to stay strong because I think the stronger that we are, the better we're going to age. So anyway, so I was going to the gym and I was just thinking, oh my gosh, I'm not maintaining muscle like I used to. I'm certainly not gaining any muscle. And that was really frustrating. And I didn't have the energy when I was in the gym either to kind of like push through. I was just constantly lagging. And then my recovery time, I was sore so much longer. So I had that going. And I started to think, well, maybe that is my testosterone. Maybe that has taken a dip. So there was that. And then there was absolutely the brain fog and the moodiness. Like, I'm a pretty happy person all the time, like very even keeled, very positive. And my quote unquote bad days were like bad days. I didn't want to get out of bed. I just wanted to binge watch TV. I had no energy. I was very apathetic. I was like, meh, nothing excited me. And the brain fog, like, I still work. I have to be on task. And I was struggling at the computer just to stay on point and to stay focused and to think about what I need to do tomorrow. So it was really kind of a struggle. But anyways, so then I came in, found out my testosterone was an 8, got pelleted by Sharon here, and it was perfect and painless. In a couple weeks, I didn't I didn't notice that the headaches were going away, but I realized that later. But in the gym, I feel so much better. My husband's really enjoying the effects of the testosterone in my body. And it's just everything I just mentioned has completely improved. And so I'm a huge fan.
I mean, for me, my personal experience, like, before we decided to dive into the hormone placement, you go into, an information session, and I'm literally staring at the screen and I'm like, oh, wow, all of these things that they're listing in terms of all these side effects, anxiety, depression, fatigue, brain fog, low libido, all of those things. I'm sitting there looking at the screen and said, I feel like that is me,
I remember that.
And so, for me personally, I'm 38 years old. Okay. I work 2 jobs. I have 4 kids. I'm always all over the place. Everybody knows me, that knows, like, oh, wow, you're always working. You're always doing this. You're always doing that. You spend time with your family. I do all those things. And when, it was surprising when I had my labs checked that my testosterone was at a 10. And you're like, oh, okay, well, what does that mean? According to your labs, that's a normal value for a woman. But when we talk about optimizing hormones, we talk about how women feel the best when their testosterone level is 150 to 250. And so, you know, and for me being 38, and, there's that misconception of, you're too old, too young to get hormones, I wondered to myself, like, okay, if I'm 38 years old, why is my testosterone a 10? Because I'm drawing people's labs that are in their 40s and 50s that have higher testosterone as me. And then you think of just in general, when okay, I have 4 kids, I had to conceive through IVF. So is that the reason why my hormones fell so
Mm-hmm.
fast? Right. And that's, it's another topic that people don't like to be open about, but it's something that 1 in 4 women deal with is infertility. And so I wonder too, was that why my hormones fell so fast? Was because, for years I injected myself estrogen, progesterone, just to be able to conceive children. And then I'm 38 and I'm like having every symptom, right? Extremely fatigued, never had anxiety a day in my life. And then all of a sudden I was having anxiety attacks. And you just bring that into thought and say, why is this happening to me? And obviously, everybody around you is like, it's because you're tired, it's because you work a lot,
You should
but
just eat a piece of toast.
yeah. And then you
Drink more
literally
water.
get hormone replacement therapy and all of that goes away. And you're like, this is what it was. And that's why I'm truly a believer.
Mm-hmm.
And I have to be a believer in order to, talk to other people about it and push things. Cause I will never push things on other people that I don't feel like
Mm-hmm.
works
Mm-hmm.
and that I haven't personally experienced myself. So
right.
that's totally my story and why I so much believe in hormone replacement therapy.
Dang, girl. I didn't even think about the IVF.
Mm-hmm.
That's intense.
Mm-hmm.
Your body went through a lot.
Mm-hmm.
So. And we're done.
This project was so fun and very educational for everyone. And a very special thank you for Jen Weiss and Sharon Mitchell for doing this project with us and educating people on the Evexias pellet that we offer here at MedSpa by Beauty Bar. Like, subscribe, and get notified by hitting that bell icon. Thank you so much for watching.